trigger finger is not uncommon with EDS or hypermobility or connective tissue disorders. So in this video, I'm going to explain to you why that's happening and what to do about it. If you have not subscribed to the channel, by the end of this video, I hope you do, because this channel is dedicated to hypermobility from someone who treats joint hypermobility almost exclusively in my practice. When it comes to trigger finger, what is actually happening is the tendon does not slide or glide in its sheath. It's stuck. And that happens I would say, not very commonly, but often enough that I see it in my practice, definitely on a daily basis. So what needs to happen here is the fingers are subluxing or the joints are hypermobile. They go beyond and we go into that extreme zone of the tendons living, the zone of injury, the zone of fixation, the zone of going beyond the normal range of motion. When it comes to these types of problems, what I find to be helpful is learning proper movement of the fingers, proper movement of the wrists, coordination of using the hands, wrists, elbow, and shoulders in movements that are safe. I use developmental exercises in my practice. These are the same exercises we all did as babies, to so much so that when we were first born, we could barely hold our heads up, and we sometime in our life, within the first 2 years, became running toddlers. No bands, no gyms, no weights, and yet we all followed the same system of movement. That means it's in our brain, and our body parts know that method of movement very well. I use developmental exercises in my practice to treat joint hypermobility, and it's very successful, not because I'm doing it, but because that's what our brain and our body parts are very familiar with. We are hardwired to follow that system. When it comes to the tendon issues, I do prefer the silicone supports that you can get from Amazon more than the rings. I've noticed the rings look cuter for sure, but the rings actually become too limiting, and there are complaints there. So people buy the rings from what I see in my practice, but they end up not using them. I like the silicone ones because they do limit how far you're going to go with your finger movements. And so they put less pressure and less load on the tendons. When it comes to exercises, I do like exercising my fingers on the floor and teaching my patients to exercise their fingers on the floor and try to practice activation of the intrinsic muscles in the hands, which are in charge of the fingers. So we're going to go ahead and do this together. What I would like for you to do is find yourself in a seated position, either on the floor or on a chair, whichever works for you. You don't even have to do this on the floor. You can do it on a table. You can do it against the wall. I'm going to do it on the table. What matters here is you don't want to be bringing your hands together. You want to place your hands just under your shoulders. So if I'm going down here, my shoulder width is as wide as you see. So I'm not going to place my hands close to each other. I'm going to place them directly under my shoulders. If you have wrist issues, slide your hands a little bit farther away from you so you are behind your wrist instead of being on top of your wrist. What you want to do is you want to spread your fingers as much as you can. Well, I shouldn't say that because you probably can go much farther. You want to spread it not to the very end of what you're capable of, but short of that. Then what I would like to do is to simply press my fingers one at a time onto the floor, as you can hopefully see. Can we see that, Desiree? A little. Okay, so let's just say this is the surface, this is the floor. I'm simply pressing there. Only I'm in air, it's easier for me to hyperextend and press, but on the floor, it's not easy to hyperextend. So practice activation of your fingers onto the floor, and practice trying to get the whole surface of your hand pressing into the floor, not because you're loading the wrist, but it's a movement of the wrist to the floor like so. So the whole time then I'm going to be pressing on the palm of my hand and pressing my fingers one at a time, and then all of them at the same time. As you're doing this, pay attention to your upper trap, your body, and your shoulders. Make sure you're not holding your breath as you're doing this exercise. This exercise simply activates the right muscles to support the fingers and allow your fingers to practice how far they are to go. You're not pressing with just the tip or just the middle or just the bottom portion of your finger. You're pressing with the whole finger to the floor. Once you've done that, this is, by the way, something that's an offshoot of developmental exercises, those baby exercises I was telling you about. The next exercise that I want you to do, which is what I do with my patients, this is something you did about 8 months of age when you were a baby. You're going to be laying down on your side, so much so that your shoulder is not over your elbow, but away. So you're going more towards that wall, and your forearm is pressing onto the floor. I'm going to move forward here. My fingers are nice and widely apart. My neck is on the same line as the rest of my spine. So if my spine's going in that direction, my neck is not that way or this way or forward. Most likely, you're going to be in a forward position. So glide your neck back, not shove it back, but glide it back. These are some of the exercises that I have posted on my YouTube channel. If you haven't subscribed, please make sure you do. These are developmental exercises which apply proper principles of movement into your profile of movement. So back to the exercise, I'm going to press on my fingers without cupping my palm up. And I am going, for my whole body is going in that direction. So my forearms pressing and sending me in that direction. And that's when my fingers are pressing. This palm is on the floor. I'm lifting myself up from the wrist to the elbow and up and back. So make sure you don't stress your neck. You're not using your shoulders to lift here. You are pressing on the hand, which then lifts at the wrist, elbow, and shoulder at the same time. Of course, you do this bilaterally on both sides. And do understand that while fingers don't have to do with the neck, a lot of times, because of the hypermobility, we tend to not use the end parts of our upper and lower extremities, that's your hands and fingers and ankles and your feet, as much as we should. And so a lot of times their lack of performance end up being a load on the wrist, elbow, and shoulder. And most likely, elbow and shoulder and wrist are the problem areas in you as well. I hope this video helped you. Please understand the proper way to gain strength is developmental exercises, because they allow you to have proper foundation. Otherwise, you're trying to build a structure over an icy surface, which means it's not going to last. Thank you so much for watching, and until next time, take care.